2 years ago, COVID-19 spread through the South. It was the beginning of mask and quarantine and a strain on hospitals and the people who work there. The spread appears to have slowed down, and doctors and nurses say they have learned a lot. Our Desmond Matthews talks to a local nursing director on how he and his team have adjusted. Destin?
That's right. Medical researchers say we may always live with some form of the coronavirus, but as I learned today, healthcare workers are back to seeing what patients normally come to the hospital for during the spring in Mississippi, and that's allergies.
Hospital hallways empty of COVID patients were what healthcare workers wished for 2 years ago. That wish may finally be coming true. Since March of 2020, doctors and nurses have learned quite a bit about the coronavirus and the way it changes.
It'll mutate, that's why you have all these other variants, but hopefully it'll just mutate until it keeps getting less in severity and it will turn into your common cold.
Jeffrey Whitfield is the director of nursing at Tyler Holmes Memorial Hospital. He says the hospital used to be full almost every day, but now things have settled down.
COVID's died down. It's not as prevalent as it was beforehand. In our area, it's little to none at all. I think our last patient we tested positive here was on the 16th of March.
The number of COVID-19 patients may be slowing down, and that means for healthcare workers, life is getting back to normal. Whitfield says his team has been seeing more common ailments.
We're starting to see more of our common illnesses now. We're starting to see more flu, more strep, and this time of year, your sinusitis and allergies type things.
And through the toughest of times, Whitfield learned a lot from the pandemic. Two of those included patience and adaptation.
It's been very hard during this pandemic. It's been very stressful. And, now it's kind of like breathing a breath of fresh air. But, learn to adapt to any situation because it's constantly changing and evolving.
Whitfield still encourages people to be safe, especially going out in big gatherings. He says although COVID isn't the main topic, it doesn't mean it won't resurface.